All of us prescribe aspirin almost every day for our patients with coronary heart disease or for patients that need antiplatelet therapy for other reasons. Each time we do, I would bet that we think of the risk of hemorrhage that aspirin therapy carries with it. But a lot of other questions are also out there. For example, is there a difference in aspirin complications in diabetics? And does the risk of hemorrhage offset the benefit? Now in JAMA, researchers from Italy report on the incidence of major GI and intracranial bleeding in individuals with and without diabetes taking aspirin. They use a population-based cohort for more than 4 million citizens in Italy and found close to 200,000 who had prescriptions for low dose, that is less than 300 milligrams of aspirin. They followed them and a set of controls for 6 years. The overall incidence of hemorrhagic events was 5.6 per 1,000 person years for aspirin users and 3.6 per 1,000 person years for those without aspirin use. Interestingly, use of aspirin was associated with a greater risk of major bleeding in most subgroups, but there was no difference in those with and without diabetes. Nevertheless, irrespective of aspirin use, diabetes itself was independently associated with an increased bleeding risk. So what's the take-home message here? First, aspirin use is associated with an increased risk of major GI or cerebral bleeding, but the differences seem to me to really be quite small, a difference of about 2 hemorrhagic events per 1,000 person years. Second, patients with diabetes had a higher rate of bleeding, but that was not associated with aspirin intake. I'm Peter Block, and this is a CardioSource Heart Minute.